Hi guys. In this video we are going to study about scalp. What is scalp? The scalp is the soft tissue covering the cranial vault. The forehead, though not covered with hair, is included in the scalp. Let's see what are the extent of scalp. In this picture you can see the scalp is limited anteriorly by the supraorbital margins. The superior nuchal lines and the external occipital protuberance of occipital bone limit the scalp posteriorly. The superior temporal lines and zygomatic arch are the lateral limits on each side. Let's see what are the layers of scalp. The scalp consists of 5 layers: skin, connective tissue, aponeurosis, loose areolar connective tissue, pericranium. The skin of scalp is characterized by plenty of hair follicles, sebaceous glands, and sweat glands. Skin is firmly attached to the epicranial aponeurosis through dense fascia. Clinical correlation. It is one of most commonest site for sebaceous cyst. The superficial fascia is characterized by dense connective tissue. It contains the blood vessels and nerves of the scalp. The fibrous strands in the superficial fascia are fixed to the walls of the blood vessels. This factor prevents retraction of the blood vessels when injured. Hence, scalp wounds bleed profusely. The bleeding in the scalp is controlled by application of direct pressure of the digit or by placing the surgical sutures. The musculopneurotic layer consists of 2 parts: epicranial aponeurosis and muscular part composed of occipitofrontalis muscle. Epicranial aponeurosis. It is freely movable on the pericranium along with the overlying and adherent scalp and fascia. The galea aponeurotica covers the vault like a helmet. On each side it is attached to the superior temporal lines. Anteriorly it receives the insertion of the frontalis. Posteriorly receives insertion of the occipital bellies and attached to the external occipital protuberance. The occipitofrontal muscle consists of 4 small bellies, 2 frontal bellies and 2 occipital bellies. These bellies are united by large central aponeurosis. The frontal belly has no bony attachments. Posteriorly, it is attached to the galea aponeurotica and anteriorly its fibers merge with those of superficial muscles of the forehead and the orbicularis oculi. It is inserted into the superficial fascia of the eyebrow. The action of the frontal bellies is to raise the eyebrows and produce horizontal wrinkles on the forehead. The occipital belly of each side takes origin from the highest nuchal line and the mastoid part of the temporal bone and is inserted into the galea aponeurotica. Clinical correlation. The first, second, and third layers of the scalp are fused with each other and move as a single unit. These layers are termed as surgical layers of scalp. The alternate contraction of occipital and frontal bellies moves the scalp forwards and backwards. Next layer is loose areolar tissue or subaponeurotic layer. It extends anteriorly into the eyelids, posteriorly to the highest and superior nuchal lines and on each side to the superior temporal lines. This layer forms a potential space filled with loose areolar tissue beneath the aponeurotic layer. The emissary veins, which communicate the veins of the scalp with the intracranial venous sinuses, pass through this space. This space is closed on all sides except anteriorly, where it extends into the upper eyelid. It is known as the dangerous area of scalp. Black eye. The blood and fluid collecting in the layer of loose areolar tissue following a blow on head tracks freely under the scalp, producing generalized swelling over the dome of the skull. Blood slowly gravitates into the eyelids because the frontalis has no bony attachments. Caput succedaneum is the formation of swelling in the newborn skull due to stagnation of fluid in the scalp layers. This is a temporary swelling since it results from the venous congestion of the scalp due to compression through the birth canal. The swelling of caput succedaneum is diffuse because it is not restricted to any particular bone. It disappears within 24 hours after delivery. Fourth layer also forms safety valve hematoma during fracture of cranial vault. The signs of cerebral compression do not develop until the subaponeurotic space is fully filled with blood. The last layer is pericranium. It is the outer periosteum of the bones of the vault. It forms a loose covering for the bones except at the sutures, where it is continuous with the endocranium. Cephalermatoma is a subperiosteal collection of blood. Since the periosteum of skull loosely covers the bones of skull except at the sutural lines, where it is firmly attached to the sutural membranes, the hematoma is bound by suture lines and assumes the shape of related bones. It is firm and its edges are well defined. It is commonly found in parietal region. Next we are discussing about arterial supply of the scalp. Arteries supplying the scalp are branches of either the external carotid artery or the ophthalmic artery, which is a branch of the internal carotid artery. The following arteries supply the anterior quadrant. 1. Supratrochlear. 2. Supraorbital. The above two arteries are the branch of internal carotid artery. 3. Superficial temporal artery is the terminal branch of external carotid artery. The following arteries supply the posterior quadrant of scalp. 1. Posterior auricular. 2. Occipital artery. These two arteries are branches of external carotid artery. Venous drainage of the scalp. Veins draining the scalp follow a pattern similar to the arteries. The supratrochlear and the supraorbital vein unite at the medial angle of eye to form angular vein. The superficial temporal vein joins the maxillary vein to form retromandibular vein. The posterior division of retromandibular vein unites with the posterior auricular vein to form external jugular vein. The occipital vein drains into the suboccipital venous plexus. The plexus in turn drains into the vertebral veins or internal jugular vein. The deep parts of the scalp. Via emissary veins that communicates with the dural sinuses. Emissary vein connect the extracranial veins with the intracranial venous sinuses to equalize the pressure. The veins are valveless. Two sets of emissary veins. Parietal emissary vein, which passes through parietal foramen and communicates with the superior sagittal sinus. Mastoid emissary vein, which passes through mastoid foramen and communicates with the sigmoid sinus. Next we are discussing about lymphatic drainage of scalp. The lymphatics in the occipital region initially drain to occipital nodes. The lymphatics from anterior part of the scalp except the lower half of the forehead drain into preauricular lymph nodes. The lymphatics from posterior part of scalp drain into mastoid lymph nodes. Nerve supply of scalp. The nerves in front of the auricle are derived from trigeminal nerve, whereas those behind the auricle are derived from the second and third cervical nerves. Sensory supply of scalp. The scalp on each side of the midline is supplied by asensory nerves, 4 in front of the auricle and 4 behind the auricle. The following sensory nerves are present in front of the auricle. Supratrochlear nerve. Supraorbital nerve. Zygomatico-temporal nerve. Auriculotemporal nerve. By branches of all 4 divisions of the trigeminal nerve. Sensory nerves behind the auricle. Great auricular nerve. Lesser occipital nerve. Greater occipital nerve. And third occipital nerve. By branches of all four divisions of the spinal cutaneous nerves, C2 and C3. Motor supply of scalp. Nerve in front of the ear is temporal branch of the facial nerve. It supplies frontal belly of occipitofrontalis muscle. Nerve behind the ear is the posterior auricular branch of the facial nerve. It supplies occipital belly of occipitofrontalis muscle. Next we'll see what is the temporal fossa. The temporal fossa is a shallow depression, bounded superiorly and posteriorly by the superior temporal line on the frontal and parietal bones, and inferiorly by the zygomatic arch, anteriorly by frontal process of the zygoma, and zygomatic process of frontal bone. Its contents consist of temporal muscle, superior temporal artery, a branch of the mandibular nerve, the anterior and posterior branches of the deep temporal nerve, the auriculotemporal nerve, and the temporal branches of the facial nerve. Layers in temporal region. There are 6 layers in this region. The first and second layers are the same as in the scalp, skin and cutaneous tissue. The third layer is a thin expansion of the epicranial aponeurosis of the scalp, from which the auricularis anterior and superior muscles arise. The fourth layer is the temporal fascia. The fifth layer is the temporalis muscle. The sixth or the last layer is the same as in the scalp. Pericranium.